Hi, my name is Dr. Smith, and today I'll be sharing with you some brief information about our dizziness and vertigo recovery program. If you're watching this website, you're probably been diagnosed or experiencing some level of dizziness over the past weeks or months or even years. Dizziness is basically, I'd like to divide it into two different categories. One is more of an acute onset where you have a sudden onset of dizziness, and one is more chronic where it's just affected your life over time. Usually the acute symptoms, say you're having some dizziness with, you wake up with it, or you're somewhere and you all of a sudden start having dizziness, and you start to have numbness on the side of your face, or maybe lapse in and out of consciousness. That's usually a really bad sign. You're probably going to be at the emergency room. So I'm assuming that you're not having that type of dizziness at this point. If you're having the chronic type of dizziness, you've probably been through several different treatment options and realized they can be very frustrating. You may have gone through physical therapy. You may have had some MRIs or brain scans and they've come up negative, and you may have been through, maybe had several rounds of blood work, maybe tried different medications. Meclizine is one of the biggest ones that I see, and it just hasn't worked for you. So what I'd like to do today is talk to you about several of the different types of chronic dizziness that we can help in our office, and then explain a little bit about our program. One of the frequent causes of dizziness is cervicogenic, and that basically means it's coming from the neck. There's an immense amount of spinal receptors in the base of the skull and in the upper neck. And if those receptors aren't functioning properly, maybe from a misalignment or from some trauma or scar tissue that's formed there, then your receptors that are sending information to your cerebellum are not going to work properly. Another type of dizziness is called benign positional vertigo. And in this case, maybe you're laying in bed and you turn your head or roll over, and all of a sudden you feel like you're whirling and spinning. This can be very, very disruptive because it makes it difficult to function or even get out of bed. Another type, several other types can be what they call prodromal, where you have dizziness that's indicating something else. Like, for instance, some patients with MS actually start to get dizziness as some of the precursors of their symptoms. Drug-induced dizziness also occurs. Sometimes people have allergic reactions or responses to dizziness that affects their nerves. Now, I mentioned before the medical approach tends to be the medication of meclizine. If that's not working for you, I've actually heard other patients come in and tell me their doctors have recommended to surgically cut the vestibular nerve. And I would definitely consider some other more conservative approaches before I'd have that procedure done. Now, there are multiple causes of dizziness. They could come from your heart. It could come from blood pressure, maybe too much or not enough blood pressure medication. You can also have eye disorders, or like we mentioned before, the neck disorders. And you can also have some types of dizziness causes that are more non-benign, meaning more serious. And if there's an area at the back of the brain, in the posterior part of your skull, with a tumor or some position, some cerebral spinal fluid abnormality, those need to be eliminated too before we would treat you. Now, there's three basic areas that have to do with balance in your body. And the cerebellum, as we've mentioned in our other videos, is actually the master integrator of all three of these areas. The vestibular nerve actually sends signals to the cerebellum, and that receives information from the eyes and the inner ear. And there's also receptors in the feet and the spine which send information up to the cerebellum, and that cerebellum has to integrate and coordinate all that information because it tells the brain where your head is located in space, the speed that you're moving if you're walking or in a car. And a lot of people who have dizziness disorders also have motion sickness. And it usually is a problem where the cerebellum isn't healthy enough to integrate all this information. But this is something we can figure out, and it's amazing if you look at it functionally from a neurologic perspective and metabolically, making sure the blood sugar issues are resolved, maybe anemia is considered. If you can find and do the appropriate testing, We always do a thorough case review on our dizziness cases. And basically, if we look at it from the neurologic aspect and the metabolic aspect, we're able to help a high number of people resolve this condition and get their life back. If you're interested in receiving more information about our vertigo and dizziness recovery program, I encourage you to request our full-length DVD where we talk in a lot more detail about the specific testing and the specific causes, and we'd be glad to get that information to you and help you understand really what is the cause of your vertigo and your dizziness. I just want you to know that if you make the right choices and give your body and your brain what it needs, that dizziness recovery could be just around the corner for you. Hope this information was helpful. Have a great day.